Thank you, Ashley. And good evening, ladies and gentlemen, NPA members. Welcome to this webinar tonight on equality, diversity, and inclusion in community pharmacy. The pandemic has highlighted a widening of health inequalities in our society, which sadly has impacted adversely on BAME communities and those with a disability. As an integral part of its local community, it's interesting to learn and understand what more we can do as community pharmacists and our teams to reduce the health inequality in our neighbourhood. To help us explore this, joining me this evening, I have my learned friend and colleague, Amandeep Doll, Head of Professional Belonging at the RPS, who will be sharing her thoughts on the subject. And as always, may I invite you to join us later to the Q&A and answer session on this debate at the end of our session. Now, during this session, we may talk about some rather sensitive issues that may resonate with you. And if you wish to discuss these further, please contact the NHS helpline and the pharmacy support hotline, in addition to the NPA advisory service, and the lines will be available at the end of this webinar. So, Aman, what more can we do to address the widening health inequalities in our neighbourhoods?
Hi Helga, and welcome to everyone that's attending. I just want to say a thank you to inviting me here, and I'll go through a bit of a presentation I've got for about 10 minutes, and then we can open to questions. So I just want to say from the beginning, I'll share my screen, but we're all kind of on a different journey with inclusion and diversity. So it may seem like I've started from the basics, but I just always like to start from the beginning, just because we don't know like where everyone's at with this topic. So just a bit of a background about what the RPS has been doing and how long the strategy has been out, and then why it's important for us to consider this topic as in terms of patient delivery and the care that we're delivering, but also from a professional point of view. So we launched our strategy a year ago now, and it was developed and co-created with members of the profession. And we started this work in 2019 with a survey for the profession, and we ran some workshops as well. And that was open to members and non-members of the RPS and everyone that works in the pharmacy team. So it was open to technicians and support staff, as well as qualified pharmacists and students. And the key thing about this strategy is that no one should be left behind, and that we want to make sure we're creating that sense of belonging, but also considering the intersectionality amongst us. And when we're talking about inclusion and diversity, it isn't just based on the Equality Act protected characteristics that are defined as the label, so age, race, but it's also the broader diversity of thought, the different sectors that we will work in, and that what we can bring to the table. Pharmacy is a really unique profession in that we work in loads of different areas, and we have all very different experiences, even from the areas that we work in. And it's how we bring that diversity of thought and experience into the conversations that we're having to improve the profession. And in doing this, and in having these conversations and improving inclusion and diversity, it does involve tackling hard and difficult issues and bring about that meaningful action and change. And that might not necessarily be because people don't want change. It might just be because they don't recognize that the systems or the policies that are in place actually are discriminatory, or they're not fit for purpose any longer, and there's barriers associated with them. And so we need to work collaboratively from across all levels of the profession, and that includes from a national level within organizations, but also from a grassroots level of how are we all working together, and individuals taking responsibility on how they can create that sense of belonging for their teams. And the RPS are really pleased to be leading this essential piece of work, but recognizing that we need to be agile and alive to a changing environment. And that's really been seen from the last year, since the pandemic, and how things and the focus has changed completely. So from the survey that we did, so our pledge, our strategy is based on 3 strategic priorities. And that is 1, to create a culture of belonging, to champion inclusive and authentic leadership, and thirdly, to challenge inclusion and diversity barriers. So everything we do is underpinned by these 3 strategic priorities. And we're always keen to hear from members of our profession on how we can do that better. We have outlined a 5-year strategy, but again, recognizing that we need to be agile to the changing environment around us. And this is just a timeline of the activity that we've planned for the first year, which is ambitious, but we recognize that we need to actually, if we want change to happen, we just need to push forward. But a lot of this information can be found on the RPS website as well. So the survey that we did in 2019 actually showed us that there is a need to talk about inclusion and diversity. And the reason why we need to be agile and what the last year has shown us is that the survey told us that disability was considered to be the biggest barrier to working in pharmacy and needed the most support. And that was then followed by age, pregnancy and maternity status to barriers working in pharmacy. And we need additional support for age and race. However, we know what's been happening over the last year and a half, and with COVID and the Black Lives Matter movement and people being more open about their experiences of discrimination, particularly racial discrimination, we've decided that actually our first priority was disability, and it continues to be, but we have also added in race and race equality within that too. So we shifted the disability campaign to the end of this year, and we've done a lot about racial equality because we felt we needed to take that as a priority. So it is always a bit of a working document, and we recognise that. In some ways, it was really positive. Nearly 2/3 of the profession found that they found the profession welcoming, and that was really linked with the experience. So the longer you've been qualified, the more confident you are in being yourself. But there were obviously examples of how pharmacy isn't welcoming. So flexible working came up a lot, the lack of accessibility for disabled staff members, be it visible and non-visible, and then obviously the representation in senior leadership from Black, Asian and minority ethnic groups, and also from an LGBTQ+ background. So it was positive in some ways, but clearly we need to do more to improve the inclusion element of the diversity piece in our profession. And then, so what things that we could be doing are actually, what we've done in the past is we've attended Pride, and we need to keep that going, but also recognizing that there's other things that we could be doing and other protected characteristics we could be focusing on, and also making sure we're embedding this from the early careers upwards to make sure that we're enacting that change for the long term. We know that, and I'm sure everyone on the call now knows that the profession is really diverse, and that's something that we should really be celebrating, and that's not something we have been celebrating or making the most of. So it's how do we make sure that we're inclusive and giving power to all the voices around the table in a fair and equal way. So why is inclusion and diversity important for the profession? Like I've just mentioned, we're diverse, and that diversity of experience and thought really should be harnessed, because there is documented evidence to say that if we're enhancing the diversity and inclusion in our teams, one, it's better for the staff, it improves the staff morale, people feel like they can be open and honest, and they can be more innovative and creative in their work, and also it helps with their well-being, but also improves patient care. They're more likely to deliver better patient care, more likely to highlight when an error has been made or when systems can be improved. And also they'll be delivering more culturally aware patient care as well. If you recognize the diversity within your team, you'll know how to talk to people, ask those questions, then that will be seen in the patient care that you deliver. We've seen that there's a lack of representation of diversity across the profession, and that's not representing the communities that we serve locally. So what we need to do more to address that. It's been well documented about the GPHC fitness to practice cases, that there's an overrepresentation of Black, Asian, minority ethnic groups, which they're working on. The differential attainment gap for undergraduate and pre-registration students from particularly a Black background, but also from our Asian and minority ethnic groups. People don't feel comfortable in disclosing their disability status. So in doing this work, people do come to me and talk about their experiences, and it's been really eye-opening and disheartening at times to hear how people feel that they can't be open and honest, and that then is a barrier to the support, getting the support that they need in the workplace to be able to have a good work-life a good experience in work, particularly from a disability point of view. And then they're not always given the support that they need, because individuals don't know how to give the support that people with disabilities need, or there's not that structure in place amongst organizations. Members of the LGBTQI plus community feel like they can't be open about who they are, their status, their partner, and they don't always intentionally correct people, or there's always an assumption made about the partner that it's always a heterosexual couple. If you're a parent, if you're a same-sex couple family, then the parent is always assumed to be a father, or vice versa. And so it's how do we become more inclusive in the way that we're thinking, and just not assuming, because so from the people that I've spoken to, people feel they have to keep coming out every time, every time they speak to someone new. So it's how do we minimize that, because that can be it can be uncomfortable. That links into the language, just thinking about the language that we're using. Is it gendered? He, she? Can we be more inclusive and use they, for example, instead of maternity leave? Could it be more family friendly leave, or parental leave? So just thinking about how we can, because it might seem very small to us, but that can be really, that in itself sends a message that we're an organization or a team that actually understands what that means. So people are more likely to feel like they're going to be open about these things. It's well documented that women take on more of the caring burden, and flexible working can result in exclusion to progression. So how do we make sure that gender equality is considered within all of this, particularly with COVID and working from home and women taking on more of a caring responsibility? Because working flexibly and working from home is great, but then you don't want that to be the added pressure for women to say, well, it's okay, you can go and pick up your kids and attend that meeting. So how do we make sure that there's not inadvertent pressure put on women? And then individuals with long-term conditions or caring responsibilities that might not necessarily be child related, and how do we support our staff in, with that as well? And then from a patient care, so we've done a lot of work with NHS England and APTUC on the inclusive professional practice plan about delivering inclusive practice. But some of the reasons why it's important is because there's depending on which part of England that you live in, there's a 19-year age gap, year gap in healthy life expectancy. Learning disability, so males have there's 14 years less for males if they've got a learning disability, and 17 years lower if you're female. And that's also been seen with COVID. You're 6 times more likely to die from COVID if you have a learning disability, and 4 times more likely to die from COVID if you're from a Black, Asian and minority ethnic background. Trans people from the LGBTQ plus community are underrepresented, so they don't access mainstream services and therefore avoid them, the health services that they might need. And then Black women are 4 times more likely to die in pregnancy than white women. So the stats are all around us of why health inequalities are so important to address, and we all deserve to live a healthy life, no matter where our background is or what experience we've had in life. And so with inclusion and diversity, there's 2 bits, as I've just highlighted. There's the public element of it, the patients and the people that we're seeing on a day-to-day basis, the service that we're delivering, and the role that we can actively play. And then there's the profession element of how do we make sure we're treating the patients as we should, treating our team, and vice versa. And there's a bit in the middle about, do we have that representation at the right levels? Do we have that staff engagement? Do we know how we're, are we inviting people proactively to be around that table? And it is all about removing that barrier rather than trying to overcome it. So how do we just make sure that it's fair for everybody? And that might not necessarily be that the same rule applies to everybody, that we have to take each individual as its own case. And as I've already mentioned, the IPP plan with APTUC, and there was just a bit about authentic leadership and what that could mean and how you could do that. So it's just about making sure that you're actively including your team in decision making. So if there's services that you're providing in your community pharmacy, are we using the diversity in our team members? Because most likely, from my experience of working in community pharmacy, that the team members come from the local community, and how are we using their intel and knowledge to the services that we're delivering? Are we including the patients in that decision making? Are we treating our colleagues fairly without prejudice and discrimination? And is there a culture where people can raise issues if there are any within your team? And do we ask our staff, how would you prefer to be called? Do you want to talk about your background? And you've got a religious festival, what's it about, for example? Just getting involved, and then being aware of your own unconscious bias and thinking about the language. So they're just some examples of how we can be authentic leaders. And in support of doing that, we've launched our Inclusion and Wellbeing Pledge, which sets out this aspiration, recognizing that everyone's at different stages, but we want to kind of set out what we should be doing and to nourish that and sustain a safe working culture for the profession, and maintaining well-being, because it is interlinked, as well as having its own issues with well-being. So we've launched that pledge, which again, you can go on the RPS website to have a look at, to see if that's something that resonates with yourselves. And it is just to kind of promote that conversation in a safe way. I'll stop there. Because I'm conscious of time, and invite any questions from people who have attended.
Thank you, Amanda. That was very helpful and very thought-provoking. With I'm sure a number of our members. We, as you know, we as the NPA sit on the stakeholder group on the equality, diversity and inclusion, and have in the past worked quite hard in the background to try and reduce and continue to try and reduce the health inequalities in our society. And what you shared with us a bit more is getting us to think that a bit more as to what more we can do ourselves as not only as health professionals, but also leaders in our own pharmacy. And in fact, this brings me to my first question from our audience, who obviously thanks us about the presentation and ask us if there's any top tips that you can give us for busy community pharmacy employers to ensure well-being of the team.
So I completely recognize that it's a really busy environment, but even like small things, and I work with Heidi, who's in our wellbeing team, and some of the suggestions that have been made are just asking your team members every day, how are you doing today? But making sure that you're not crossing any boundaries. So if people feel like they want to share, they can, or if not, just recognizing that, and just creating that space. So is everyone able to take their breaks when they can, or get their lunch if they can? But also, just I suppose it's just creating that environment where you can say, if you need to talk to me about something, please feel free to talk to me about something. And I suppose it's making sure that if you are saying that, then it needs to be authentic, and you're going to create that space to allow that conversation to happen. And I know in my own work experience, sometimes I have to just have to do it after work, because that's the only time, which I know does encroach on our own time, but actually can be quite powerful for the individual who's struggling. So I hope that is helpful.
So I guess you've mentioned throughout the presentation, you mentioned the importance of language, and particularly recently, as a result of what we've seen, a result of the pandemic on BAME communities and so forth, we've seen a lot of language which is quite difficult for us. For example, allyship, and also authentic, as you just mentioned. So can you help us work through what we mean by authentic self? Now, in our environment in the pharmacy, most of us will be wearing a uniform. However, if I want to be my authentic self, I might choose not to wear a uniform, because that does not fully represent me. But jesting apart, really, how can we ensure that we always maintain a professional balance between our own authentic selves and the profession that we represent?
So I suppose there's an element about being your authentic self that is your personality, being able to share who you are. right, and as opposed to physically, because I think there's that element of professionalism that we all need to maintain. You know, I would love to have bright pink hair, but I can't because it, you know, it's, in my role it's not very professional. But so there is that balance, because we still got to deliver a service, and our patients still need to trust us to be able to ask questions and trust that they're getting right information. And that authentic piece is about bringing yourself to work, about your personality, that you're able to contribute to the team, and you know, you're not hiding yourself, you're not hiding a part of who you are. So for example, a very personal example, I'm quite chatty, as you know, Helga, and anyone that's met me, but I was told that if I ever wanted to be a senior leader or considered be taken seriously, then I have to stop being so smiley and stop being so chatty. And I felt then I couldn't be myself. So it's kind of that attitude of, you know, actually that's a really good thing if I'm able to engage with people. So it's that element of being your authentic self, that we need to encourage and let people bring to the table.
Yes, I think I'll be quite horrified if someone told me to stop smiling and stop being chatty. Actually, I think you've handled that really well there, Aman. So may I also invite our attendees to put your questions to the Q&A session, and I will continue to pose these to Aman. We will be finishing at 7 p.m. or thereabouts. And if we don't answer all the questions, we will continue to do so after the session. But, you know, this is the beginning of a dialogue, isn't it? It's an important conversation to be had. We're very pleased that the NPA and RPS have jointly producing this webinar this evening. So thank you very much, Aman, for joining us as our main guest speaker and talking about what the RPS is doing more. We as community pharmacists, as you know, Aman, we don't always have the same access to support and training that other sectors do in the NHS. It's something that, you know, wears us down day and day. Tell us, what is the RPS doing to get the NHS to recognise community pharmacy as a workforce that also needs support? We, as a sector, we have our own discrimination against, don't we? And, you know, we've been working together on this and various others. What can we as the NPA do to help you?
So we are actively lobbying, so the government and the NHS to access that helpful community pharmacy. And I know that our Director of England, Ravi does that a lot. So it is just continuing to advocate and lobby on community pharmacies' behalf, but also recognizing that there's things that the RPS can do. So, you know, we've opened up all of the I&D resources to everyone in pharmacy, and you don't need to be a member to access them. And it's thinking about what is practical, you know, so we've done like allyship workshops, we've done race microaggression workshops that is more about practical support for an individual and creating a bit more of a safe space to have those conversations. And we are constantly always working with pharmacy support as well, in making sure that the services are available, and working with other groups. So we have been working with the UK Black Pharmacists Association. There's a Women in Pharmacy group, and so we are continuing to advocate. I know it can feel like we're constantly banging our head against a brick wall when it comes with community pharmacy and getting access. Seen that a lot throughout COVID, but we are continually advocating behind the scenes, which I know doesn't probably feel like it's coming fast enough. But from an NPA's perspective, it's working along with us. You know, we need to hear from our your members what support they need, and so that we can advocate on that behalf, but also what practical things that we can do and provide in our resources that would be helpful.
Right. Well, as you can see, we have a good working relationship. Long may it continue. And I hope it continues after this next question that I have for you, Aman. Aman does know me that sometimes I do ask some rather interesting questions. And I guess this is where we talk a bit about, you know, the reality and what we're talking about. So we do know the well-known statistic is that 45% of pharmacists are from BAME background. And we can therefore argue to an extent that we as the NPA membership may have already addressed this diversity essay question. However, we also know, and again, you mentioned the statistics, they're all around us, they are there, aren't they? that we know 60% of pharmacists on the register are women. We know that some are also for an LGBTQ plus background, but sadly, we don't know what that percentage looks like. So how can we ensure that we do not forget about those who we perceive to be outside the BAME definition? That is women, white other, shall we say, the gay woman, the gay man, and so on.
So that's why, like, it's so important to have this conversation, and that's why it's so important to say that diversity isn't just the legal category that's been assigned. It's about thinking, well, as an individual, who am I, what am I, and what do I represent? And that's the narrative we need to change, is about you're treating everyone as an individual person, and also recognizing that with that there's different barriers, and there's no one size fits all approach, and we all have to take responsibility as organizations in remembering that as well, and making sure if we're saying we need representation, then we want representation across the board. That doesn't just mean that we've got one male, black male, or one like brown female, and then we've done, but it's actually, what does that diversity look like for the profession? And constantly proactively seeking that, because a lot of this work isn't just about just waiting for it to happen. We have to go and do something about that. And also thinking about, if you go on a panel, I've just had someone ask me about a panel that I've invited them to speak on, and actively asking who else is on that panel with me, because I can't be on a panel that's not diverse, so who else have you got, which promotes that thinking of, actually, are we being representative? But I think it's also being okay and comfortable in saying, that we need to do better, and making sure that underrepresented groups are highlighted, and being explicit. So we've done that with the national boards. We've put a call out to say, we recognize that representation is lacking. We want that representation. Come and join us. So we need to do a lot more of that, to make people feel that they are welcome.
Thank you. I guess what we're saying, isn't it? It's think of the individual. Let us not be generic. Let us not generalize. But remember that there is a person, just like we know as pharmacists, there is a person behind every prescription. There is, again, a person amongst our teams, ourselves, with our own baggage, personalities, cultures, etc., upbringing that we come up with. Aman, we could talk about this. I'm sorry that we're just going to have to bring it to a close. Half an hour is not enough. We look forward to maybe having further workshops with our NPA members, and maybe having some more practical examples. We know that NPA members are very active in this sphere. This is the beginning of the conversation. This is the beginning of the dialogue. And once again, I'd like to thank you very much indeed, round of applause, really, to start us on this conversation this year. So, ladies and gentlemen, thank you very much for joining us for the first of this evening sessions at the NPA Conference 2021. The NPA conference will continue later on this evening at 7:30, where I will be joined by my colleague, Louise Baglol, and we'll be talking about workforce issues and the current workforce strategy that is happening within pharmacy sector altogether. So look forward to seeing you there. I shall leave you all with the NHS helplines, the pharmacy support lines, and the NPA Health and Advisory Service that I shared with you earlier. If you have any further questions, any further thoughts, future sessions that we can have on this, please write to me at independencevoice@npa.co.uk. And once again, a big thank you to Aman, a good night, and a God bless to all of you.
Thank you.